Hi, this is Dr. Rudra Mohan and welcome to the Oral channel. Today we are going to be talking about a topic known as mucocoele. Let's start. So today I'm going to be talking about a very common cyst-like formation known as a mucocoele. Basically, it is a cavity which is cystic in nature, but which can be truly cystic or pseudocystic in its nature depending upon the cause of its production. Now, mucocoele is basically a soft fluctuant swelling that is usually seen in the lower lip, followed by the tongue, followed by the buccal mucosa and other places in young adults and children, usually as a result of physical trauma or the consequence of the blockage or obstruction of a minor salivary gland. Now, if the cause is physical trauma, it becomes an extravasation mucocoele. That means the minor salivary gland duct can get injured, because of which there is a rupture and spillage of mucin, that is the material of the minor salivary gland, and thereby after that it causes an evolution in the change that after the mucin spillage happens, that the defense cells of the body, such as the histiocytes and other defense cells, they come in and form an inflammatory granulomatoous tissue, after which a pseudocystic swelling develops without an epithelium. That's why an extravasation mucocoele is actually not a cyst. It's not a true cyst because it does not have an epithelium. However, a retention mucocoele, right, is actually a true cyst because of the fact that due to the obstruction of the salivary gland, either due to flow rate being small or some sort of stricture, or a cyalolith, that is a salivary gland stone, into the gland, there becomes a cystic cavity with an actual epithelium containing mucus and all these things, and this is known as a retention mucocoele, also known as a ranula if it happens on the ventral side of the tongue, because it looks and resembles like that of the cheeks of a frog, or the ranulae basically. And now it is usually painless but can be a cosmetic emergency for a lot of people. So 95% of the cysts are extravasation mucocoeles and 5% is retention mucocoeles. Now it happens in young children because of the fact that they are very prone to trauma because of their age and how they behave at that age. Secondly, what we need to understand is the treatment is same for both. It's very simple. The diagnosis starts off with how you see it. It is a transparent, soft, fluctuant, bluish swelling that is associated usually with the lower lip. It is usually compressible. However, if the the cyst or the mucocoele has dried out, it will not be compressible and it will be very flattened. Secondly, the treatment is very simple. Either you have to undergo a scalpel surgery for its excision, or electrocautery or electrosurgery or cryosurgery, or in the cases of larger cysts you have to go for something known as marsupialization, where you create a pouch and create a drainage for the cyst to drain till it becomes completely alright. So to be very honest, mucocoele is very common and it can present as a cosmetic emergency for a lot of people. The diagnosis is actually confirmed by actual excision, and afterwards you can do a histopathological examination under the microscope. However, clinically it is very discernible because it actually stands out, but you have to keep in mind that there might be some other salivary gland disorders related cysts that might be present. So it is always better to confirm your diagnosis after the excision with the help of histopathological examination or a fine needle aspiration biopsy. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to contact me, here is my information. Kindly refrain from calling me directly. You can drop me a message and I can get back to you within some time. And if you feel like you have any apprehensions, queries, doubts or suggestions, please feel free to do so in the YouTube comment section. That's it for today. Thank you.